Hi, this is Patty Gilbaugh from Grace C. May Advocate Center. Today we're going to talk about psychosis. There are several different types of mental illness diseases that incur the symptom of psychosis, but psychosis by itself is not necessarily a disorder. Most people who have psychosis actually only end up having one episode in their entire lifetime. When they receive help, they get better, and they never have it again. There are other conditions, though, such as schizophrenia or bipolar, where psychosis becomes more problematic. So what is psychosis? Well, psychosis is a series or maybe one episode of psychotic events where you have delusional thoughts or you have hallucinations. Delusional thoughts are ideas that are bizarre or strange or just simply fictional. Those thoughts make you think things that are true when they're not, or they can also confuse you or disorient you, and sometimes they can leave you feeling very paranoid. For example, some people with delusional thoughts might feel like their food is being poisoned, so they're afraid to eat. So they choose not to eat, and then they get sick from not eating. Other delusional thoughts could mean, maybe you think that I work for the CIA, and I'm here to uncover all of your secrets, and then I'm going to report those back to the CIA. Well, that's probably not true either. So those are bizarre, kind of strange thoughts that make people feel very paranoid. The other thing that we worry about with psychosis is this hallucinations. And those hallucinations are things that are auditory or olfactory, which is your sense of smell, or your visual hallucinations. So you can see things that aren't really there, you can hear things that aren't really there, or you can smell smells that aren't really there. And that confusion of the senses makes it really hard to tell whether or not something is real or not real. There are medications that can help you with delusional thoughts and your hallucinations. But until you have them diagnosed, sometimes it's really hard to sort out what is real and what is not real. So let's talk about what some of those things are. The psychosis is actually a condition in which a person has lost some contact with reality. And we kind of covered that, but it's really important to note that a person may have severe disturbances in thinking, emotion, or behavior. The disorders which psychosis can occur are not as common as depression and anxiety. They're actually less than 3% of the population have a psychotic disorder. Psychosis actually occurs in episodes and is not constant, and it doesn't continuously happen. So some things that you might notice when symptoms of psychosis are developing. You might notice that you have an increase or severe level of depression, anxiety, irritability, suspiciousness, blunted or flat or inappropriate emotion, a change in appetite, or reduced energy and motivation. It's not uncommon for people to stay in their house and shut all the curtains and lock the doors and not come out for long periods of time. That's probably due to the delusional thoughts or paranoia, but could also be due to hallucinations. So you would have concentration or attention holding problems. You wouldn't be able to stay focused for very long. You would notice this by people looking off to the sides, or turning their head, or looking like they're talking or paying attention to something that isn't really there. A sense of alteration of self or others or the outside world is another symptom. This means that feeling that yourself or others have changed, or feeling or thinking that they're acting different, and unusual perceptual experiences. And so those could be a change in color, change in vision, a change in sound, or sometimes even a change in smell and taste. What we would notice in behavior when somebody's having psychosis, first and foremost, is sleep. Sleep is the one thing that we know that really disturbs the way that we think. And so when we have psychosis, it could actually be simply from a lack of sleep. And sleep is also a symptom of psychosis. So the psychosis could come first, causing an interruption of your sleep patterns. We would notice that people would be socially isolating. Despite COVID, this is a severe social isolation, like not wanting to answer the phone, not wanting to go outside, keeping all the curtains shut in your house so people can't see in. You would notice a withdrawal from any interaction. You would notice a reduced ability to carry out your work and your social roles, or just daily life functions in general. People might struggle in being able to shower, or being able to feel clean, or being able to feel like they're comfortable. And so we would notice the interruption in the daily life cycles as well. There are types of disorders that do require professional help and probably medication treatment. So those include schizophrenia and bipolar disorder. There's schizoaffective disorder, drug-induced psychosis, and psychotic depression. Schizophrenia is probably one of the more serious psychotic disorders, so let's spend a little bit of time talking about that one. Schizophrenia is known for its marked impairment for delusions and hallucinations. Typically, most people have one or more than one of each of those categories. We would also notice some disorganized speech patterns. So when you ask a question and people respond to you, but they don't answer the question, it doesn't make any sense, or it feels illogical, or maybe even out of context. You would notice some disorganized behavior, like starting something and then going on to something else, and then maybe coming back again. More than a distracted feeling, but definitely disorganized. You would notice a loss of drive, no motivation, wanting to stay inside, wanting to stay in bed, not wanting to participate in the world around them, and being even a little skittish about what you eat and the medications you take. You would notice some blunted emotions. So this would be a really flat affect, no smiling, no laughing, no contributions of facial expressions when they're talking in a conversation. It takes a lot of energy to pay attention to the voices in your head and the voices that you're talking to in real people as well. And so when you have a conversation with someone and they're having this really difficult time engaging in that conversation, they may be hearing voices and having a conversation in their head, one that you can't hear. We would also notice some withdrawal from social life. It's really hard, think about it, to carry on multiple conversations at the same time. So if they're hearing voices in their head and hearing voices talking to you in real life, that's carrying on at least 2 conversations at one time. And that can be really hard and taxing, and in my opinion, emotionally expensive. So people are just going to withdraw from that. They don't want to have to work that hard to have a relationship with people. Manic episodes of bipolar can also increase the likelihood that you'd have a psychotic disorder. So a manic episode of bipolar means that you feel unusually high, optimistic, or extremely irritable. We also have hypomania. So people who have severe levels of depression might suddenly feel, like a good mood and really liking it, but they're not quite manic. So hypomanic means that they feel kind of normal, and that's not their normal. Their normal is more of that depressed state. The other symptoms of manic episodes in bipolar include an unrealistic, grandiose belief about their ability and their increase in goal-directed behavior. So this would be a little bit like narcissism, but not quite to that extreme. So for example, feeling overconfident about their ability to maybe surf on a car roof or something like that. Just the grandiose, highly elated or highly inflated sense of being. You would notice an increase in energy and overactivity. In a manic episode, it's not unusual for people to stay up for days at a time. Some people clean their house. Some people just work. Some people exercise an obscene amount of hours. We would also notice that there would be a decreased need for sleep. And so even though they've stayed up maybe for 2 or 3 days at a time, they would still have lots of energy to spare. And that's what makes a marked type of manic episode that leads to psychosis. Because remember, depriving your body of sleep is one of the most impactful situations that lead to a psychotic episode. You would also notice some racing thinking or some rapid speech with bipolar. And distractibility. These all seem to overlap, right? So excessive pleasurable activities are very common. I will tell you that most women who have a psychotic episode in the state of mania tend to engage in retail therapy. They spend a lot of money that they cannot afford to pay. So whether it's on a credit card or whether it's cashing a check and going shopping, it doesn't really matter how it goes, but that is a very typical symptom behavior that we see in treating women with bipolar who are having a manic episode. So there is the overspending, and it's not just women, it happens to men too. It could also be a hypersex drive, or it could be gambling, or it could be any number of high-risk behaviors such as using drugs. And so we have to think about what is the normal or the baseline for that person and compare what their current behavior is to what they normally or typically would do. And then we look at also their impaired judgment. For a manic episode, the impulsiveness and the lack of insight are two things that we know to be marked impairment for psychotic episodes. So we look at, are they impulsive? Can they maintain? Can they resist the urge to follow through on the high-risk behaviors? Usually for somebody who's having a manic episode, when it is at the extreme level where psychosis is probable or likely to happen, we actually request that they do inpatient treatment until the manic episode passes. This is for two reasons. One is because it keeps the impulsive behavior at a minimum. It's hard to do things that will result in long-term risk for you if you're in a locked facility where you don't have access to your phones or to the computer or to things that can cause you harm. The other thing that being inpatient will do is get you on the right dose of medication and to be monitored very carefully while those medications are being adjusted. And sometimes being hospitalized for that period of time can help us with controlling the sleep and monitoring sleep progress. It's not too uncommon to request for inpatient treatment because we want to see patients be able to get some good sleep cycles going and to get their manic episodes to subside. So there may be a chance that your therapist, if you're working with them, would want you to do an inpatient treatment for 3 to 5 days until you can stabilize. Most manic episodes come and they go and they resolve themselves within 2 to 5 days. So if yours is persisting, we'd want you to get immediate help and go to the nearest emergency room for that help. Without early intervention with a psychotic episode, you would likely incur some poor functioning in your mental abilities. So there's a long-term consequence of having poor functioning with your cognitive processes. You also have an increased risk of depression and suicide. Psychotic episodes play tricks with your mind. You have delusional thoughts, paranoia usually, and hallucinations. And so it becomes really hard to stay in touch with reality and gets very confusing very quickly. You might also have a slower psychological maturation or a delay in assuming adult responsibilities. So it's hard to live on your own when you're having trouble with psychosis. You would have a strain on relationships around you, and you might lose some of your social supports. Especially with a disorder of bipolar, it's not uncommon for people to be all or none. You're either my friend or you're not. And if you're not my friend, I want nothing more to do with you ever again. And so there's the part or the pathway of having burning bridges in those relationships and not being able to reconcile them or to repair them. And so we want to be able to work with people when they're having a manic episode or a depressive episode even, and trying to manage or maintain the relationships and the supports that people have in their lives. We also look at the long-term consequence of disrupting your education and employment. So if not being treated with medication to stabilize, especially the hallucinations and delusional thoughts, you're putting yourself at risk of not being able to maintain your employment and or your education if you're in college. Schizophrenia and bipolar both tend to emerge in the late teens to early 20s. This is around the end of high school or the beginning of college. This is important to know because if you're feeling like you're having these problems, the increased amount of stress is most likely what triggered bringing on the full episode of the psychosis event. Stress is very much a precipitating factor in developing full-blown symptoms of these disorders. We also know that there's a correlation or relationship between alcohol use and drug use, when people are having psychotic episodes. A loss of self-esteem and confidence and a greater chance of problems with the law are two things that happen as long-term consequences. Maybe you don't need professional help for those two things, but oftentimes professionals can help with those things and get you on a better path or a better track. If you have any questions, make sure you call us and consult with a therapist at our office. This is a very serious mental health condition, a very disturbing mental disease, and we want to make sure that you have the ability and the tools to get the help that you need at the soonest point of intervention as possible. That's all we have for today, and thanks for joining us.